Hello people, namaste, welcome back to my channel. In this video, I will discuss about the another clinical question for university exams. See, the person having 20 years patient came to known type 1 diabetes mellitus. The person already having known diabetes mellitus, it is type 1. The person having anorexia, nausea, vomiting and deep and fast breathing with fruity breath. And in urine examination, the person having proteins are present and sugars are present, no blood is present and ketone bodies are present. What is the diagnosis, pathogens and complications? So this is the diagnosis: diabetic ketoacidosis. Diabetic ketoacidosis. In diabetic ketoacidosis, it generally comes in type 1 diabetes patients. Type 1 only. Type 1 we can see in diabetic ketoacidosis having a fruity breath is important one, and ketone bodies are also present. Because of ketoacidosis, ketone bodies are present. Because of these ketone bodies, it leads to fruity breath will occur. So this is the clinical features to diagnose this diabetic ketoacidosis. So in this video, I will discuss about the total diabetes mellitus. Sometimes in university exams, they ask about the classified diabetes mellitus like type 1 and type 2 and complications of both type 1 and type 2. So they will ask all these questions from diabetes mellitus. So we should discuss about the total diabetes mellitus in this video. Wait a minute. In this, so first of all, we should discuss about the what is the definition of diabetes mellitus. It is a metabolic disorder. Which type of metabolic? Heterogeneous metabolic disorder characterized by common features of chronic hyperglycemia with distributions of carbohydrates, fats, proteins and metabolism. This is a metabolic disorder. It is first you should write about it. It is an heterogeneous metabolic disorder having the features like hyperglycemia, means sugar level is increased. Because of this, carbohydrate, fat, proteins, metabolism are disturbed. Because of this metabolism disturbed, it leads to hyperglycemia. So it is an definition of diabetes ketoacidosis. So what are the major features, metabolic syndromes? Major features of metabolic syndromes are central obesity. Obesity will occur in these patients, diabetes mellitus, and hypertriglyceridemia and low HDL cholesterol and hyperglycemia also occur, and hypertension will also present in these patients. So these are the features of these metabolic syndromes. First one is obesity and glycemia, HDL cholesterol and hypertension. These are all the features. Now we should first you should write about this what is the definition. Next discuss about the major features of metabolic syndrome. Okay. Next we should discuss about the classification of both type 1 and type 2 diabetes mellitus. So what is the classification of diabetes mellitus? Diabetes mellitus has 4 types of classification, like type 1 diabetes mellitus, type 2. Generally, all know type 1 and type 2, and gestational also present in this diabetes mellitus, and special types due to because of other causes it leads to other types of diabetes mellitus. The most important are these 3: type 1 diabetes mellitus, type 2 diabetes mellitus and gestational diabetes mellitus. Why the type 1 diabetes mellitus? Generally, it can be seen in 10% of people, and more 80% can be seen in type 2 diabetes mellitus. Type 1, what is the difference between type 1 and type 2? Type 1 occurs because of autoimmune B cell destruction, leads to insulin deficiency. Autoimmune B cell destruction. This is autoimmune B cell destruction. Because of this B cells destruction, this leads to deficiency. Generally, B cells having the insulin. If B cells are undergoes destruction, then there will be no insulin will be present. So it leads to type 1 diabetes mellitus. And type 2 diabetes mellitus is progressive loss of B cells insulin secretion. B cells are present in type 2 diabetes mellitus, but secretion will be decreased with insulin resistance also increased. Progressive loss of B cells insulin secretion. Insulin secretion is decreased in type 2 diabetes mellitus, and type 1 diabetes mellitus is totally autoimmune destruction of B cells. So next one is gestational diabetes mellitus, generally common in gestation of pregnant women, gestation period of pregnant women, and other types are also present. So we should discuss about these two, type 1 and type 2 diabetes mellitus differences. What is the type 1 and type 2 diabetes mellitus differences? Wait a minute. So we should discuss about these differences of type 1 and type 2 diabetes mellitus. What is the frequency? First, we should discuss about these 14 points of differences between type 2 and type 1. Frequency, generally it is less common. It is 10 to 20% we can see in population, and more common 8 to 90% is more common type 2 diabetes mellitus. And age onset, generally this can be seen in below 35. Common in children's also, it is below 35, it is after 40, because old age people can see in old age. Next, type of onset, it is abrupt and severe, it is gradual and insidious. It is severe, abrupt, sudden, and severe, it is gradual and insidious. Next, weight, generally weight is normal. Here obese or non-obese, generally obese people have more common for type 2 diabetes mellitus. Here no weight loss or weight gain can be seen in type 1 diabetes mellitus. So first we should discuss frequency. Next, age. Next, onset, how it occur, abrupt or severe or gradual or insidious. Next, we should discuss about the weight. Weight is normal. Here weight is obese or non-obese. Next, HL association and genetics. Here association will be there in this because of autoimmune destruction. It undergoes autoimmune destruction of B cells, so it is related with HLA association. There is no HLA association will not occur in this type 2 diabetes mellitus. Next, family history, less than 20%. Family history, here 60%, because if there is any in our family have any diabetes mellitus of type 2, then it leads to comes genetics. Genetics will be present, means comes to other persons or other members of the family because of genetics. Like 60% has chances for type 2 diabetes, only less than 20% has chances in type 1 diabetes. In identical twins, in twins 50%, here 80% have chances for twins will occur with this diabetes. Next, what is the pathogenesis? Because of type 1 I already discussed, it is autoimmune destruction of B cells. Here insulin resistance and impaired insulin secretion. Insulin secretion will be decreased and insulin resistance will be increased in this type 2 diabetes mellitus. And type 1 diabetes mellitus is destruction of B cells. Next, islet cell antibodies. Antibodies, because of autoimmunity, there is antibodies will be present. So antibodies are present. There is no antibodies. Here only resistance increased and insulin secretion will be decreased. So there is no antibodies will present in this type 2. And blood insulin level, here decreased insulin. Because of there is no B cells, generally beta cells having insulin. So because of absence of beta cells, undergo destruction of beta cells, then there is no insulin will be released. Insulin will be present. So decrease the insulin. Here beta cells are present, but insulin secretion is decreased. So there is a normal or increased insulin in early stages and decreased in late stages. Generally insulin will be decreased in later stages. So this is the blood insulin level. Next, we should discuss about the islet cell changes. Like islet cells, insulitis will occur, means islet cells, insulitis means beta cells undergoes depletion because of autoimmune antibodies, antigen autoimmune, it leads to B cells undergoes depletion. There is no depletion of B cells and no insulitis will not occur in this type 2. Amyloidosis is infrequent, common in chronic cases. Amyloidosis will occur in diabetes mellitus also. Clinical management, how we manage this condition? By giving insulin, directly by giving the insulin, because there is no insulin, because of there is no B cells, there is no insulin. So directly we should give this insulin along with diet. Here insulin is present, but it is not secreted that much. So by exercises or giving oral drugs, or by giving, if a chance, we should give the insulin also by diet. All this, by using this management, we can decrease this type 2 diabetes mellitus. Next, acute complications are because of this type 1 diabetes mellitus leads to ketoacidosis. So in our clinical condition, this is the ketoacidosis. Type 1 diabetes mellitus have ketoacidosis. In type 2 diabetes mellitus leads to hyperosmolar coma. Here coma will occur, osmolar coma will occur. This is the difference between type 1 and type 2 diabetes mellitus. So this is the classification. First we should discuss about the, what is it? Definition. This is a hypermetabolic disorder because of disturbances of carbohydrates, proteins, fats. All these metabolism undergoes changes, leads to hyperglycemic condition. After that we should write some features. After that we should discuss about the classification, like type 1, type 2, gestational, other types also present. So we should know about the type 1 and type 2 differences. Type 1 occurs because of autoimmune, type 2 occurs because of other because of insulin secretion is decreased and insulin resistance will increase. Generally common in or children's, it is old age. It leads to ketoacidosis, it leads to hyperosmolar coma. Next we should discuss about the pathogenesis and complications of this diabetes mellitus. Thank you. Please subscribe my channel and please support us. Thank you.